Hi, I'm Luz Fonacier, President of the American College of Allergy, Asthma and Immunology, and I'm here to discuss the current state of allergy and asthma in the United States. Despite advances in the diagnosis and treatment, allergies and asthma can be life-threatening. And even if asthma and allergies are not life-threatening, they can have profound effect on the patient's daily life. Environmental changes are likely to increase in the near future and make life more difficult for people with allergies and asthma. There's climate change, pollution, and urban crowding. As our population become more diverse, we need to understand how these conditions play out in patients of varying backgrounds. COVID-19 creates added uncertainty for patients with these conditions. The economic realities of healthcare put pressure on our ability to provide care for all who need it. So let's talk about asthma. 25 million Americans are diagnosed to have asthma. 1 in 10 children have asthma, and there's an annual cost of $80 billion. There's over 3,000 deaths annually, and 75% higher in Black persons than white persons. In children, this is the most common reason why kids miss school, and 13.8 million children miss school days per year. 14.2 million adults miss work days per year. 3 to 5 asthmatics have limited physical activity, and 71% misuse their inhalers. More importantly, though, 1 in 5 cannot afford their medications. What about environmental allergies? 1 to 5 Americans are diagnosed with environmental allergies, and 4 million missed work days per year has been reported, with $8 billion of annual costs. And more than 50% of people with environmental allergies say that it impacts their daily quality of life. 2/3 of asthmatic patients actually have environmental allergies. If one parent have allergies, their children have 50% more likely to have allergies as well. And if both parents are allergic, their children have 75% more likely to have allergies. Allergies are due to environmental factors, which includes pollen, dust mite, mold, animal danders, and poor air quality. They can manifest as itchy, watery eyes, rash, itching, runny nose, sneezing, and just feeling tired. Allergies can be life-threatening. 1 in 12 children have food allergies. $24.8 billion is the annual cost of food allergies. 29% of children have food allergies and asthma, and 25% of food allergic reactions occur in students without a previous diagnosis. They have a great burden on fatality, about 150 to 200 fatalities per year from food allergies, 40 fatalities from insect sting, 400 per year due to medication allergy, and 1 to 6% of Americans have latex allergy. There are recent innovations and understanding that asthma is a spectrum rather than a single disease is important. Identifying allergy and asthma phenotypes, allowing work on precision medicine treatments for the future. There are treatment innovations that have been approved, novel targeted asthma therapies, new routes of administration of allergen immunotherapy. The first drug for treatment for food allergy has been approved in 2020, and the development of biologics for atopic dermatitis, asthma, and more. There's increased recognition of racial, ethnic, genetic, and environmental differences in disease states among patients. The college led efforts in the COVID-19 epidemic to provide vital information about allergic reactions to COVID-19 vaccines. We created the COVID-19 Vaccine Task Force. We also supported members who have been in the forefront in the fight against COVID-19. We monitored medication shortages, increased risk of asthma, patients from COVID, participation in vaccine development and testing, and provided the allergy community with timely information about the pandemic, the disease, its treatment, diagnosis, and prevention. We worked to increase racial disparities and increase healthcare equity in the treatment of patients with allergies and asthma. We have provided grant funding through the college's foundation to practicing grassroots allergies to address health disparities and other challenges related to allergy care within their own communities. We partner with academic programs as well to increase awareness of the specialty among students from diverse backgrounds. We created a diversity task force. We helped raise awareness of racial disparities in asthma and allergy outcomes by providing many learning opportunities to keep our members at the cutting edge of knowledge. And we provide more physician education and patient and public information in Spanish. For our members, we have developed an in-person educational 2021 annual meeting following last year's world-class virtual meeting. We developed timely and practical resources for healthcare professionals and public. We have the anaphylaxis toolkit, yardstick on idiopathic anaphylaxis, and genetic testing for primary immune deficiencies. For our patients, we increase public awareness of the specialty. We increase awareness of our robust patient information and our public website, which currently has more than 600,000 monthly unique visitors. And for our specialty in general, we continue to work collaboratively with lay organizations like the Allergy and Asthma Network. We amplify the college's position as an advocacy leader for the specialty. We promote and publish world-class research to enable better diagnosis and treatment of allergy and asthma, as well as to advance the understanding of immunology. The college will always advocate for patients to have access to specialist care and appropriate treatments. We advocate for continued coverage of telehealth medicine benefits and licensing flexibilities. We advocate for the safest treatment protocols for allergy, asthma patients during the pandemic. We supported patients and providers with specific recommendations for the language of the No Surprise Act that aims to minimize surprise bills to patients when their healthcare is delivered by providers outside of their insurance network. The college joined other allergy organizations in supporting passage of the FASTER Act, which is great news for our patients with sesame allergy and other food allergies. We look forward to the information that will be collected and reported as part of this law. So I thank you for this opportunity to participate and represent the college in this worthwhile and very important endeavor for our allergy patients.